When talking with patients who are abusing substances, I often use a harm reduction approach. One of the common misconceptions about harm reduction is that it is an implicit endorsement of substance abuse. Let me be clear that that's not the case. Harm reduction is a patient-centered, focused approach which looks at what the patient wants to be doing, what the patient's goals are, and tries to find a way to use substances less frequently or in a less dangerous way. It is at its core an utterly pragmatic approach to the substance use problem. It recognizes that many people, regardless of what I tell them to do as a clinician, are going to continue to use. What I want them to do until they're ready to stop using altogether is to use in a way that is going to cause them less attendant harm. I think as clinicians, it's really important to understand that we broadcast what we're comfortable talking with our patients by the kind of questions that we ask. It broadcasts what we know and what we're comfortable talking about. For example, if we never ask our patients about sex, they're probably never going to tell us about sex. And the same goes for substance abuse. So it's important for us as clinicians to be well educated about substances that patients may be using. Because otherwise, we may not get that information from them. So when I start talking with a patient, I want them to see me as an ally, even if I'm really concerned about their behavior. And building that alliance, I see, is built on a sharing of information. So often I will ask a patient to tell me, what are the substances that you're using? Tell me about them, teach me about them. I want to understand how they work and how you use them. And then once we've had that conversation, I may ask them, now would it be okay if I share with you some information that I happen to know about these substances? And in that conversation, I can share ways that they can reduce the risks of what they're doing. I always make it incredibly clear that the only way to be perfectly safe is not to use at all. But in the absence of that, I want to see them use their substances of choice in a less harmful way. And that may be in very pragmatic ways, like cutting back the amount they're using at different times of the day so that they're not putting themselves at risk at work or at school or while driving. And also sometimes harm reduction involves building a better mousetrap. If a patient is using a substance, say like cannabis, for anxiety, I may be able to help them more robustly with a course of cognitive behavioral therapy or an SSRI than the benefit that they seem to be getting from their cannabis use. So these are some of the small practical tips that I recommend clinicians use in taking on a harm reduction approach.